Central Illinois is the CI in CI Living.
Exercise is as important for our dogs as it is for us. However, their joints can be just as susceptible to wear and tear as ours are.
Here in today's Forever Family with details on a new clinical trial is Dr. Kyle Chu. Welcome.
Thanks for having me.
Well, you're welcome. And we've brought a friend
today. We have Relly here.
Tell me about Relly.
So Relly's my attending's dog, and she is a mini golden retriever, and she's about 10 years old, and she's a great personality and just hangs out in the office with us all day.
We were saying earlier, she has the look of a puppy and almost like a stuffed animal, but has the demeanor of an older dog.
Yeah.
Really calm.
Yeah, she's very calm. She's good. We use her for a lot of our practicing orthopedic exams with the students. And so she's very compliant and is a very chill dog.
Yeah, well, the mini part must be where she comes in and looking little. So exciting things happening there over at the clinic. You guys are putting the call out for pet owners who may have dogs that are having some knee trouble.
Yep.
So tell me about this new study.
So yeah, so we're recruiting dogs for a new clinical trial that we're conducting at the University of Illinois. So dogs that particularly have an ACL injury that's happened, it's like the first time offender. And so dogs that have ACL injuries it's probably the most common orthopedic injury that we see in dogs. And it's a degenerative process that's seen. It's not as traumatic when we kind of think about humans and ourselves when we get ACL injuries. And so we see them in the range of dogs between like Chihuahuas all up to Great Danes.
What are we looking for in terms of, is there a noticeable, like sometimes a human can have an ACL injury that just walking around you wouldn't ever notice it. So how in a dog what are we looking for as a symptom?
So oftentimes what is reported from clients is that their dogs are playing outside and they're jumping around, and then they come back and they're all of a sudden weight bearing on their leg, or they're limping very hard. And so if you see something like that, then I think that bringing your dog in to be evaluated by a veterinarian would be a good choice, and have further evaluation to determine if that ACL is torn.
And so the procedure, tell me a little bit about it.
So yeah, we do a bone cutting procedure. It's called the TPLO, or tibial plateau leveling osteotomy. And so that surgery aims to reduce like the sliding force of the femur on the tibia, just because dogs have a natural incline and slope to their tibia. It's about 25 to 30 degrees in most dogs. And so the aim of the surgery is to reduce that sliding force by rotating and changing the biomechanics of the knee. But of course, that procedure is a little bit painful because we are cutting bone.
Yeah.
And so we use opioids and a multimodal approach to kind of approach pain. And so with the opioid crisis being here right now, it's sometimes a little bit difficult to get those opioids. So our clinical trials investigating and comparing new techniques to provide a more multimodal or well-controlled pain control in dogs after surgery.
Now, obviously, you're looking for dogs to be a part of this clinical trial.
Yeah,
so what dogs are eligible, and if they are, how do they get to be a part of the trial?
Yeah, so if they have had a ACL injury on one side, they haven't had any other orthopedic issues in their hind limbs, and they are going to be getting the TPL procedure, they would be eligible. They have to be between 1 and 8 years of age and weighing between 15 and 50 kilograms, so pretty wide range of dogs that we do surgery on. And so if they do, then they can contact the University of Illinois. I think we have the contact information.
Yeah.
And then just get in touch with me or Dr. Harper, my attending, and we could talk to them a little bit more about the study.
So as I'm reading it, it says the trial will randomly assign patients to one of the pain control methods. So that's what you're really testing, is the pain control?
Yeah, correct. So we're trying to compare and see if this new method of providing a local anesthetic infiltrate around the surgery site is comparable to an epidural. And so epidurals...
Those are fabulous.
So yeah, they provide really good pain control for up to 20 to 24 hours, but they're not without their side effects, and they're not always 100% successful. And so they can cause things like urinary retention, temporary dysfunction with being able to walk, and low blood pressure during surgery. And so our technique that we're trying to determine if it is as effective as epidurals is injecting a local anesthetic that lasts about 72 hours, so 2 days longer than an epidural around the knee. And
you guys keep talking epidurals. I'm going to keep cutting it all.
I know, right? Well, there's a lot going on. Yeah. Definitely contact you guys there at the U of I for more information. And if your dog is a good candidate, we can get them the help they need. We so appreciate you coming.
Thank you so much.
Good luck with your study.
Thank you.
Just leave really.
Yes.